How much vitamin D should you be getting? So when you go get your labs and you check out your vitamin D levels, there's usually a couple different ranges on there. There you go from 0 to 20, 20 to 30, and it says above 30 is optimal. So while I agree like a vitamin D level of above 30 is better than 15 per se, I really think that that level is usually too low, and a lot of research out there that's showing that higher vitamin D levels have a multitude of good effects. So I'd really like to see that number up into the 50s into the 70s. So that usually means you need to take more vitamin D in a day than what is maybe currently recommended. I'm getting old, but it used to be that they'd recommend like 400 units of vitamin D a day. And they've upped it to 800, but I still think that's way too low. You can get too much vitamin D. It's what they call a fat-soluble vitamin. So you can technically overdose on it. So you do have to be somewhat careful. But honestly, I think if you go up to the 4,000 units a day, between 2 and 4,000 for most people is a sweet spot. Myself, I take 5,000 units a day. And I think that it's best to take, when you get those higher doses, you take it with K2 along with it. So my current regimen right now is 5,000 units daily with vitamin K2 in there as well. It helps the absorption of it, and I feel real good with it. Vitamin D is one of the easiest things that you can actually test for lab-wise, and it's also one of those things you can actually get if you go outside, but you actually have to have exposed skin. So sunscreen blocks a lot of your vitamin D absorption. Washing your skin after you get sun actually will wash off vitamin D. It takes about 48 hours for vitamin D to actually absorb. So sometimes it's hard to get enough vitamin D outside, but I sure recommend getting outside, getting that sun in your eyes.